Switching gears now to the healthcare space. A new report by Deloitte bringing to light why U.S. healthcare cannot afford health inequities. For more on this, let's bring in Yahoo Finance's Anjalee Khemlani. I don't know if it's the healthcare system, because the inequities have been there, right? Or if it's individual Americans who can't afford what's going on.
Well, that's what it is. We're looking at what the cost is to the broad health system. And this is, I want to preface this by saying this is not the first report of its kind. And the authors at Deloitte thankfully did acknowledge that. So the numbers that they put out was that today we're spending about $320 billion more than we need to, or about $1,000 per American. And by 2040, the inequities could cost about $1 trillion. And that's, or about $3,000 per American. And that's a really large jump. And what that refers to is really the kinds of things that you would think about when it comes to what fuels inequity, right? We're talking about revisits. We're talking about bad food habits, or people not having access to food, or housing. All of these things that have over time had many different names: population health, social determinants of health, all of these things that healthcare systems, insurance companies have all been really looking at for quite some time. But no one seems to have come up with the perfect solution just yet. And this is the bulk, the crux of the conversation I had with Deloitte was, well, you're telling me something I already know. How do we get beyond that? This is the 100th report I've read of its kind. How do we get beyond that? And they're talking about more partnerships. So now we know that part of the problem has been silos, right? The healthcare system has had three very distinct silos, and that is the people who pay for service, the people who provide service, and then the treatments, medical devices, et cetera. And so how do they all partner together and come up with the solutions and work together to then reduce the cost to the broader healthcare system? So that's what their recommendations are in this report. And while that isn't necessarily novel, right, as a concept, it does kind of push, as in terms of guidance, what they can do. And we also saw, by the way, I want to point out, like, one key piece is through the pandemic, telehealth, right? We saw remote and just any kind of teleservice. And that is also going to play a key role, because they might legitimately be disruptors in this space and force the incumbents and these large players to pivot significantly from, the traditional routes that they're taking to make a profit, and think about how else they can do it differently.
And so for consumers who are already seeing prices higher in other categories that they have to buy into on a regular or cyclical basis, on healthcare, that's something that you can't afford not to buy into. But when will those prices start to come down and be kind of more parity to what consumers have seen previously, prior to some of the other inflated prices that they're seeing elsewhere?
Well, it has to be more of a commitment to actually drive down prices, rather than how can we find something that looks like it's doing good. So housing, for example, there have been many pilot programs to help fund housing for individuals who are homeless. And they've said that housing is actually a key reason why people end up more often with poorer health outcomes. And so funding that has been an option. And that has not proven to be something that is scalable, because it's either something that the healthcare provider is taking on, or they're roping in, say, a builder or a developer into the process, using tax breaks. It's all these systems to really still look at profits. And so the idea that now that consumers care, now that investors care, and they're pushing boards to now care, could yield a different outcome. That's where this Deloitte report is really looking.